So with an L4, L5 disc bulge, the first type of exercises that you're going to want to do are things that put the spine into extension, meaning going backwards. The reason for this is if you look at how the disc is situated here, typically what happens is the disc is pushed, compressed, and then the disc will come out, putting pressure on this nerve, which is very irritating to the nerve, not a good place to be. So the way to get out of that is you start pushing the spine backwards to ideally relieve some of that pressure that's on the nerve. So the first exercise that I'm going to show you is the most simple. Start with this if you have a lot of pain. The first thing that you're going to do is you're going to lay down on your belly, and that's it. You're just putting the spine into slight extension. That's the best place to start if you have a lot of symptoms. If that's too easy for you, then start working your way up until you get onto your elbows. Try that. If you feel after a couple of seconds, 10 seconds, 15 seconds, that the pain starts to subside, stay right there. If you feel the pain increase at any point, then stop immediately. If that's feeling pretty good, then go ahead and push yourself up onto your arms and put it further into extension. And then gauge again, 10, 15, 20 seconds. Is this decreasing the pain? Is it not doing anything? Or is it making the pain worse? If it's making the pain worse, you need to go back to step 2 or step 1. Now, if you have pain that's on one side, which is very common, as you're laying face down, shift your hips away from the side of pain, and then try these exercises again. That's going to allow the disc to have the minimum amount of pressure on it, which is also going to allow you to have the minimum amount of symptoms. The next exercise is really important if you have a bulging disc at L4 or L5 that's causing symptoms. So this exercise is called the Camel exercise. It's very easy, but it's very helpful. If you have a low back issue, specifically a disc that's creating symptoms like burning or stabbing pain that's running down your leg, perhaps, or even all the way into the calf or down into the foot, this is going to help to take pressure off of that. Remember, with these exercises, we want to start in extension. We want the back to go into extension because oftentimes the disc has been pushed backwards into a nerve or even into your spinal cord sometimes. So let me show you this exercise. It's quite easy. You're going to go on all fours, like a quadruped type position, and you're going to start in a neutral position. And then you're going to allow your back to sag down into that cat position. This is placing the spine into extension, and I want you to sit there for 10 or 15 seconds doing a body scan and determining whether this is helping the disc or is it hurting the disc? Is it increasing your symptoms or is it making it better? That's really important whether you're going to continue doing this one or whether you need to go back to the previous exercise that we discussed. If everything feels fine there, then go back up to neutral. Go to neutral, do that body scan again. Determine whether it's feeling good, whether it's feeling bad. Sometimes pressure on a nerve gives delayed symptoms, so we don't want to be rushing this. If this feels good, go back down into the cat position. You're going to hold that, and then you're going to go back up to neutral. So hold it for 2 or 3 seconds and then come back up. Once that feels okay, you feel like it's safe to continue, then you're going to allow yourself to do a pumping action. So it's a second down and a second up, maybe 2 seconds down, 2 seconds up, whatever you're comfortable with. Do this up to 20 reps, and then I want you to calm down and just make sure that you're not getting any muscle spasms or that you're not getting any increase in symptoms down your leg. Once you're done with that, just lay down on your belly, allowing your back to stay in extension and hang out there for 2 or 3 minutes. You determine that there's no change in symptoms, no increase in symptoms, or even better, there's going to be a decrease in symptoms, then get right back up and let's do it again. I want you to do this 3 to 6 times every day. You can even do it more, but when you first start and you have symptoms, we don't want to overdo it either. So give that a try. Hey, if this is helpful, just hit that like button and then hit the subscribe down below. This just helps other people to be able to see these videos that are having similar issues as you. So thank you so much. I appreciate you, and I hope you have a wonderful day. For the next exercise, we're going to do the pelvic tilt. This one is really helpful because it's weight bearing. However, be very careful because weight bearing is double-edged sword, both a good thing and a bad thing. If you haven't done the other ones already, don't do this one first. So the good is that as it's weight bearing and we're shifting back and forth, we're working that disc just like this. So you've got this disc that's bulging here and we're working it back and forth. If you're highly symptomatic, it's going to go the opposite way and it could make it worse. Start in a neutral position and you're going to move your back into extension. You're going to slide your hips forward and then you're going to stop there. Again, you're going to assess, do your body scan and determine within 10 or 15 seconds, is this helping or is this hurting? If it's helping, or if it's not increasing symptoms, then you're good. Then you go back to neutral position. If that feels good, wait, body scan, assess, then go back forward again. Don't go back yet. Don't start pushing your back into flexion just yet. Even if you're feeling quite confident that this is the right way to go, we don't want to overdo it. If you're just now getting over symptoms, don't overdo it. The disc is still in there, okay? It's close to the nerve, but it may not be tagging it, and we don't want to make it tag it. So go back into extension, back to neutral. Back into extension, back to neutral. What you should notice is that there's a relieving type feeling. If you still have them going down your leg, it should be moving up your leg slowly. With a disc, oftentimes the symptoms are delayed. So if that's feeling good, then you can start testing going into flexion. I want you to do 20 of these back and forth, back and forth. With this exercise, I want you to, if you've graduated from the others, I want you to do this one again 3 to 6 times a day, 20 reps. Work your way slowly up and down. However, you know your body best. So if you're getting fatigued and that's causing the symptoms, then stop. Call it a day, lay on your belly again, use the ice, take the Epsom salt bath, try and relax. You know, when it comes to disc bulges, the saying no pain, no gain does not apply. Do not take that advice. Did you know that the things that you're eating in your diet are actually making your spine weak? Don't make the same mistakes. Check this one out up here.